Welcome back. 3 of Jamaica's primary healthcare facilities are currently near COVID-19 capacity, with others close to the danger zone. This as the country has seen a spike in cases of the pandemic. Here to speak to us on this, we have with us the hardest working woman I know, Chief Medical Officer at the Ministry of Health and Wellness, Dr. Jacqueline Bisesa McKenzie. Good morning, Doc. How are
Hi,
you?
good morning. Happy New Year to you and to your listeners.
And the same to you. Thank you so much for taking the time out to speak with us because I know you're super busy.
Opening our computer as we speak, you see it? Workday has begun early.
Yes.
Oh, wow.
All right, talk to me, Doc. When you say the hospitals are at full COVID-19 capacity, exactly what does that mean?
Okay, so we have essentially 3 types of beds that are reserved for COVID. We have the general wards that have been designated as COVID wards. Some of them have been retrofitted to allow for the proper spacing and the separation from the rest of the patient population. Then we have the high dependency units. These are spaces, as you know, at the start of the pandemic, we would have made every effort to try to get in as much ventilators as possible to create high dependency spaces separate from what we usually cater to the general population. So we have the high dependency spaces, and then we have the intensive care units. Now, intensive care is not just only ventilator capacity, but there is just a comprehensive treatment that requires various specialties and persons who are trained in the critical care management of patients. So we have 3 different spaces separate from the general population or the general capacity of the hospitals.
Okay, so let's talk a little bit. So KPH, you have a red zone, right? That you monitor, which
over 85%. Normally, you would want to your hospital capacity to be below 85%, because if you go above 85%, it usually signals that there are some areas of the hospitals that may be over 100%. So the 85% is an average, but you may have a demand for medical beds versus surgical beds versus pediatric beds.
Okay.
So 85% is a good area to say that once you touch 85%, you really should be alerted to look closer how it is that you start to put in place your interventions, such as you may have to move patients around the hospital. You may have to look to see why it is that some beds are not usable, how to fix that quickly. You may have to look at transfer of patients to other facilities. You may have to look at curtailing admissions in other areas for non-acute cases so that you can manage the acutely ill patients.
So Falmouth, Spanish Town, Linstead hospitals above 85%. Falmouth 89%, Spanish Town 88%, Linstead at 123%. KPH hovering just below 84%. Same as Black River. Percy Junior, Mandeville Regional 77%, Savannah Lamar 82%, Noel Holmes in St. James at capacity, with Falmouth exceeding the necessary number at 128%. Are we nearing crisis?
We right now at this time, as we have said before, that coming to the end of the year, going into the first part of the year, our hospitals tend to really come under a lot of pressure because we get a lot more trauma cases and we get a lot more general medicine cases. So we tend to have a problem at this time in terms of making sure that we manage our beds properly.
But that coupled with, I guess, the numbers that are going to come out of Christmas and come out of...
Right, of COVID. So that has put additional pressure. The good thing, however, is that because of COVID and because we have curtailed some of the activities in some of the hospitals, we don't have a lot of elective cases, and we don't have the non-acute, so many of the non-acute cases. So occupancy generally, and persons are staying home in terms of those persons that are not ill enough, because usually we get the hospitals flocked by persons who need to be there as well as those who don't need to be there. So, and hospitalizations arise because of various reasons, not just because of persons being necessarily ill to require hospitalization, but you have other reasons, such as you choose the opportunity to investigate persons. You have persons that have other issues that may require hospitalization outside of medical causes. So because of COVID, we find that generally speaking, our hospital attendance has decreased. So when you see our numbers going up at this time, you would realize that it's on a background that generally our hospital attendance has decreased, but we have now started to see it going up again.
Gotcha.
Yeah. Doc, I wanted to ask, and you may not be able to answer, but I see where in the UK they're pulling back the field hospitals that they packed away. I know there was a time when we were also thinking of setting up a kind of field hospital here in Jamaica.
I think we had set one up,
Yeah,
didn't we?
is it functional? Is it still a consideration? Is it something that we may be looking at, seeing that everything now in terms of capacity in the hospitals may be a challenge?
Right. We have to make sure that all the tools in our toolkits are ready for use. We have to make sure of that. Jamaica has not been seeing so far, and I have to be very cautious when I say that, the kind of increase that would really put us in danger, and of having persons increase waiting on beds. We have not seen that as yet. And this is why we monitor closely, because whenever we see these hospitals going into the red zone, we know that we need to do something. But we have not seen that kind of over capacity that would require us to use the field hospitals so far. Because if you look within a region, if it is that one hospital is near capacity, we have other hospitals that are available that we can transfer patients to. That is how it is right now. So if you look at the region, for example, if Kingston Public Hospital is near capacity or at capacity or over capacity, then we have National Chest Hospital that, if you look at the figures, their numbers are down. And we also have St. Joseph's Hospital that we have expanded space there to create space for overflow. So within each region, although we will have one or two hospitals, for example, again, just to look at Western Region Hospital Health Authority, we have hospitals like Noel Holmes and Falmouth Hospital that are type C hospitals that are above capacity. But we would have other facilities, for example, the Cornwall Regional Hospital, that we may be able to accommodate persons at.
If there's an overflow.
If there's an overflow. So
Okay.
recently, Sacramar has come under tremendous pressure because of the increase in numbers in Westmoreland. And we've had to keep a very close eye on that. They have had to create more spaces for COVID patients, and they would also need to have to transfer their patients that are critically ill, severely ill, to other facilities.
All
So
right,
we
Doc.
still have a little bit of a gap, that we're not at the space where we're utilizing the field hospitals, but we do maintain that these are necessary just in case.
Okay.
Because we had put in everything to plan for a surge, and we're at the beginning of January. We're expecting that by the second week in January, the 7th, going on to the 10th, 11th, we may be seeing any further increase
In cases.
based on the time period in December that we had more
Ahead of time.
exposure.
All right,
Doc.
Doc, we have
Right.
to go.
Yeah.
Bless you, and bless your team for the continued hard work, and thank you for taking the time to speak with us this morning.
Have a great
Thank you.
day. Please stay safe. Joining us,
Chief
just
Medical
now.
Officer, yes, at the Ministry of Health and Wellness, Dr. Jacqueline Mesesa McKenzie. We take a look now at News in 5, and still to come, Dr. Edmund Bartlett remembers Gordon Butch Stewart.